So glad everyone is here, and how awesome that we are gathered together again to worship together after 4 years of being apart, right? I just got goosebumps while we were worshiping. So glad we're all here. So glad to see you all. And it is my pleasure to introduce our devotion speaker for today, Dr. Kris Prenger. So Kris has many hats, many talents. She's a medical doctor. She has all sorts of theology background. And she served in Bangladesh at Lamb Hospital for 24 years. And Kris is just wonderful. She's also a member of our conference planning committee, and she is a deep woman of faith and just a kind and compassionate soul. So I am so glad to welcome her to share with us today. Welcome, Kris.
So hi, good evening. I'm going to read out the scripture, which you see in front of you. It's also on page 12 in your program. And then unpack the scripture a little bit and then pray to open our time. There's questions in the program. They're kind of for personal reflection. So this is a relatively brief version. As you see, 1 Corinthians chapter 15, verse 58. Therefore, my brothers and sisters, stand firm. Let nothing move you. Always give yourselves fully to the work of the Lord, because you know that your labor in the Lord is not in vain. Let's just pray briefly. Father, we come before you in this beautiful place, dedicating this time to hear from you through your word. We confess our sins, perhaps blaming fellow travelers or transport workers along the way. We ask you to help us forgive those who seem to frustrate our plans, perhaps those who held on to passports or delayed visas so other friends couldn't be here. We cast our cares on you, and we now release them into your perfect peace. Amen. So we are just a week on from Pentecost. It was May 28th. The Jewish feast of Pentecost was initially mandated in Moses' law as a thanksgiving for the first fruits of the wheat harvest. And then it was later associated also with a remembrance of the law given by God to Moses. And the church now can see the gift of the Holy Spirit given on Pentecost as the first fruits of a new time. The Holy Spirit as first fruits gives us a promise, a taste of the love of God, a glimpse of the glory of Christ, a beginning of a new life that will be ours forever. And the context for our verse here in 1 Corinthians chapter 15, in verse 23, Jesus is called the first fruits of the resurrection. In verses 54 to 57, just before our verse, we're reminded of our future resurrection. When the mortal puts on immortality, then death is swallowed up in victory. As we just heard in that fantastic song that I'd never heard before, the Lamb has overcome. Victory is won. And thanks be to God who gives us the victory through our Lord Jesus Christ. So Paul here is presenting Jesus' resurrection life as the foundation for the hope we have. This is the therefore. Therefore, since we have this firm hope in Christ's resurrection. And here in the verse, we gather in that hope as brothers and sisters. We have in common our trust in Jesus' victory over Satan. Hallelujah. We have in common living in the church age, 2,000 years of not yet seeing Jesus coming again. No resurrection yet for those who belong to him. And here we are at the Catholic University, and we can look in the liturgical calendar year where Pentecost signifies the beginning of what's called ordinary time between Lent, Easter, Pentecost, and Advent. There's this long time in the calendar year. And sometimes our work might feel in vain because it takes a long time to see real change. In some ways, this devotion is a little bit of a lament for what we hope for, but sometimes don't see in our long, ordinary time. But Paul called us to stand firm. Let nothing move us. And that standing firm can be steadfast, having a moral fixedness, not running around. We are steadfast, but sometimes things go too slow because of political or natural sort of disasters in the places we work, supply chain issues, pandemics. Sometimes we don't know all the factors that slow down progress. Engineers Without Borders came up with something called a failure report to help learn from identifying what contributed to failure. You can find the template on admittingfailure.org. In this morning's workshop, we also heard about adaptive management, and they gave us kind of lots of tools to deal with the same sorts of things. But in this first fruits metaphor, these problems might be the weeds, but they might be the fertilizer that leads to greater growth. So along with sometimes things going too quickly, sometimes too slowly, sometimes they go too quickly. We proceed too quickly with maybe a work that we weren't right for, maybe with partners that weren't the right partners. And earlier in the book of 1 Corinthians, in chapter 10, Paul also notes he's concerned about the Corinthians' tendency to compromise behavior and even their beliefs for the sake of the culture in which they live. So we need to be on the alert as well to when we might go with what the easy money is for, go with things that we're not necessarily right for. So we know lives are complex, situations are complex, but we are steadfast, immovable. We remain courageously engaged. International health workers battle to increase spiritual, physical, social, emotional well-being. So being immovable doesn't mean standing still. In not standing still, Paul again exhorts us to always give ourselves fully to the work of the Lord, abounding, doing more than what's necessary sometimes. But we have to again remember this isn't doing things in our own strength. And sometimes we may start to get worried, oh, am I enough? Is our program good enough? But our abounding, our excelling, our diligence, our zeal are possible because it is of the Lord. It flows from his resurrection life. It is generous giving. And as I heard recently, don't live as if the gospel just came to you. Live as if the gospel came to you on the way to somebody else. Don't live as if the gospel just came to you. Live as if the gospel came to you on the way to somebody else. And one commentator said the work we do, the decisions we make, the people we help, the justice we fight for, the hope we preach, the prayers we offer, all those help us keep our lamps lit for the moment the bridegroom comes. From Matthew 25, the parable of the wise and foolish bridesmaids. So we as Christian health and development workers, our organizations, we're just bridesmaids. Temporary job as we wait for the Lord to return. Come, Lord Jesus. But we can wait in hope because we know that our labor in the Lord is not in vain. And again, we sometimes do feel like, are we wasting our time, our resources? This can be hard, at least for Americans who often want to be efficient and effective and find a better way, be good planners. But labor implies pain, worry, trouble, weariness. And the Greek word in vain literally translates empty. It's also used in chapter 15, verse 10, God's grace without effect. In verse 14, preaching is useless. Those are all the same word. But it's not in vain because we know. And the word know in Greek, this is like a little Greek section here. The word know means fullness of knowledge, having seen or perceived truth. And though we often can't see the circumstances around us, what's ahead, or even really understand what's behind. And in a sense, it's like a little kid who doesn't need to know what's going on. Little kids never know what's going on. But they look to their parents. Their parents frame their experience. And those kids know they're part of a family in an ideal, in the way God intended things to be, that they're part of a family. In the family, here in the Lord, and a little kid who's helping mom cook or clean, a little boy who's helping his dad, build something. They're learning skills. They're maybe learning to tell the truth. But for the parents, those things are all part of a process. The first fruits of growth to maturity, which brings delight to their parents as they look forward to a fullness of knowing. And we know whose we are. We know God delights in our work. So believers, the church is where N.T. Wright says, God's future comes into the present. It is only in the future that we will fully know. But right now we know our work isn't in vain. So I'd like you to stand. As God's future comes into the present, we stand with those whose lives are hard, unjust, end early, as God stands with them. We stand worshiping the one we know, praising and worshiping Jesus, whose power reconciles, restores, and resurrects. God gives life from death. We stand in our short timelines, aware of our limitations, but persevering in hope. God is the Lord of the harvest, and we expect our first fruits to be part of the abundance of his work. We know our timelines are within his eternal purposes. Let's pray. Lord God, let this opening of the 2023 CCIH conference be the first fruits of what follows in these days together. Bless our fellowship as beloved brothers and sisters. And we pray for this time as we equip and support one another to stand firm in our hope, founded on resurrection power. Thank you, our work is not in vain or empty, because you fill it. You fill us, and we give you glory. Amen. Please be seated.
Thank you, Kris. It's my pleasure to introduce Mr. Dick Day. And Dick is the Senior Vice President of Programs and Volunteers at CMMB, but Dick is also the chair of the CCIH Board of Directors. And what I've appreciated about Dick over his years as the chair of our board is just how thoughtful and purposeful he is in giving feedback and advice to the staff, but also Dick just radiates joy. Joy in his service at work and with his family, and I really appreciate that about him. So welcome.
Well, good evening. On behalf of the board and our wonderful CCIH staff, it's my pleasure to warmly welcome you to our annual conference. We're delighted that you're here to join us for a few days of learning, fellowship, networking, and hopefully recharging. In the best of times, working in resource-constrained environments is challenging. However, the past several years have been particularly exhausting, and for some of us, probably even depleting. It's been a time of pouring ourselves out to meet the demands of a global pandemic on top of the typical sources of stress that we have as we strive to be ministers of healing to vulnerable and underserved populations. It's exciting to be back together As Mona said, we're about 175 strong here, and we have about 225 more joining us remotely. Through COVID, we've learned that being together actually matters. There's a richness of fellowship and connection that is simply not possible remotely. We've also learned that it's important to recharge, to care for ourselves, to step away from the day-to-day stresses of our work, to reflect, to learn, to be ministered unto. The board of CCIH has been reflecting on some of the learnings that we've had as an organization over the past several years. So going forward, I'm pleased to announce that every 2 years, we will be meeting here in Washington, D.C. for an in-person conference, which we will also have people join us virtually. We believe that it's important for the U.S. government and for our partners to see that global faith actors like each and every one of you are playing a major role in taking quality health care to the last mile. Then we'll have regional meetings in the in-between years. So we'll be having a conference every year. Finally, CCIH's online platform became very popular during the virtual conferences that we've had the last several years. So we're going to be starting a virtual learning institute this October, and more to come about that in the coming days. As we gather today, our theme is Hope in Health. Your labor is not in vain. Over the next 2.5 days, we'll explore what that actually means. We will derive hope by reflecting on and sharing the differences that we are making as each of us act out of the unique callings that God has given us. We can also derive hope by being together, sharing our challenges, and encouraging one another to stay the course. Whether you're here in person or joining us remotely, I am so glad that you're here. You are here for a reason. We can each feed each other as well as be fed. We can each be an encourager as well as be encouraged. We can each be teachers as well as be learners. So may God bless each of you over the next several days, and thank you so much for being here. It's now my pleasure to hand off to Doug Fountain, CCIH Director, to provide some welcoming remarks.
Thanks, Dick. Good evening. I was craning my neck around to see who's in the room that I haven't had a chance to say hello to yet. So I'm now seeing faces that I really haven't seen yet. And I'm just so excited to see people. I know there's others coming in tomorrow, but do me a favor, take a minute right now and look at each other side by side and say, I'm so glad you're here. Is this? I'm sorry. Okay. I hope you got a chance to find out the person's name too. I forgot to ask you to do that, so it looked like you guys took off pretty well. This is never a bashful group of people, so never has been. Does it feel like it's been 4 years since we've been together, for those of you that are old timers with CCIH? It feels like it's been longer. You know, I look at some of you, I think, gosh, your faces are similar to what I remember from 4 years ago. I personally have been on the journey of gaining some weight, losing some weight, gaining some weight. You know, these are the things that always go on. And so it's always great to see people. My memory for names is going to be horrible, so I'm glad that we have these things. Please make sure that when I see you, Ray Martin, when I see you, please turn your badge so that I can correctly identify you. And You can make a suggestion. Dude, you should be the executive director here for a while. I think that'd be a great idea. Wow. I am so glad to see you all here. It's terrific. Let me go ahead and get started. Is this funny? Mona, it's okay now? It just sounds fuzzy in my ears. So if you're okay, then I'm okay. All right, great. Well, super. Great. Well, for those of you, how many of you are here for the first time? You've never been to a CCIH event before. Oh my gosh. And how many of you have been to CCIH like for 25 years? You know, you've been coming from the beginning. That's right. Ray is sitting next to Ann Peterson up there, who I look forward to saying hello to also in a short bit. It's great. You know, one of the things that I always find in meetings like this is people don't really know much about what CCIH is. And so just a few bits about who we are. We are a global network of over 100 organizations and hundreds of individual members who work in over 90 countries to advance health and wholeness. At CCIH, we are committed to improving local participation in global programs, making faith-based partnerships easier to achieve, engaging faith leaders in global health strategies, improving results from faith-based partnerships, and increasing government and donor support for global health and faith-based partnerships. There's a lot of positive verbs there: improving local participation, making faith-based partnerships easier, all of these things. We cannot do that ourselves at CCIH. We actually count on you as members, and so we take it very seriously. When you're a member of CCIH, we lean on you for information, for insight. It's really practical and tangible. And to that end, let me also quickly, before I forget, acknowledge you can't pull a conference together like this without an amazing staff. So first off, thank you to the CCIH staff. You also can't pull something like this together without our amazing sponsors. And one of the things that I love about this venue that we picked is that we actually have got room right out here that you'll be walking by the sponsor tables a lot over the next couple of days. Please take time to get to know them, because each of them have something here to share with you, and you have something to share with them. So I encourage you to do that. It's also exciting to be a Catholic. You know, we started this process in 2019 to come here. We had the agreement signed by the end of 2019. Mona, did you say this already? I can't remember. Good, I'm glad I'm not repeating. But we started this process in 2019 thinking we'd be here in 2020, then 2021, then 2022. Here we are, finally. So man, Catholic University is a great place, but I'm so sorry for those of you who got lost trying to get here in the traffic and the navigation. Kris, I appreciated your prayer. All the ways that could go wrong for people to arrive here on campus in this building. It's as tricky as could be. This week we are here to talk about hope and health. And Dick, I really liked your introductory remarks there. They were very helpful. We selected this theme after recognizing how challenging the last few years has really been. And we wanted this conference to be a bit different. You know, we don't usually take stock of how far we've come to encourage each other with the challenges that we encounter. One of the things that I really, I was prepared to give you like my 4-point plan of how I wish Christian organizations would change the face of, and confront the challenges and all. And then I read an op-ed yesterday morning by William Christoph in the New York Times. I don't know how many of you might have seen that. Any of you? Yeah, Kate, you saw it. That was, well, I threw out half of my speech. And I'm going to quote him. And for those of you who are here, Florence, you're here, Sister Josephine from Sierra Leone, raise your hands if you're here from Sierra Leone or you work in Sierra Leone. How many of you are here from Sierra Leone or have done something in Sierra Leone recently? All right, here's what he said. Nicholas Kristof, one of my favorite columnists, wrote after wrapping up a visit in Sierra Leone. This is what he said. One of the misimpressions people have about the world is that it's going to hell. Perhaps that's because humanity's great triumph over the last half century, huge reductions in poverty, disease, and early death, goes largely unacknowledged. He said, the risk of dying, he's speaking about Sierra Leone, the risk of a child dying is less than half what it was 20 years ago. Deaths in pregnancy and childbirth have plunged 74% since 2000. More than 90% of pregnant women in Sierra Leone now get prenatal care, and the great majority are assisted during delivery by a trained midwife, nurse, or doctor. Health centers are beginning to take on cervical cancer, which kills more people worldwide than maternal mortality, but gets much less attention. Great stories, great data, but one reason the world doesn't do more to help poor countries is exhaustion and a sense that nothing works. Kristof writes, I fear that misperception is driven partly by journalists like me and by aid workers, advocates, and other bleeding hearts. Do we have any journalists in the room? Do we have any advocates in the room? Do we have any bleeding hearts in the room? It is true, when we only focus on the negatives, we forget to build on the positives. And Kristof describes that age-old maladies like leprosy, polio, fistula, guinea worm, river blindness are all receding. Eye health is managed, club feet are corrected. And he says, get this, we are privileged to live in an age of miracles. This is biblical. The blind see, the lame walk. This progress is as authentic as all the perils that make the headlines. That is how I can wind up a visit to one of the world's poorest countries and emerge with hope. Now, Nicholas Kristof he's not writing to a faith-based audience exclusively, and I don't know where he is on his own faith journey, but those words really sunk in with me. And I grab a hold of similar stories of things that I hear around the world. And recently, last year, in fact, I was in Tanzania, thanks to the Christian Social Service Commission, who's here. They arranged a meeting for me at St. Joseph's Hospital in Moshi, Tanzania. At St. Joseph's, they had just completed a data system overhaul to collect payments from national health insurance. Okay, sounds a bit wonky. Their revenue has multiplied, offsetting their investment. It's a good thing. I was in India a couple of months ago, and the buzz there was about declining Christian hospitals, and that is certainly a challenge. But I took note of something else that people spoke about. The Christian organizations are on the forefront of disaster preparation, equipping all local religious groups to anticipate everything from droughts to floods. These local initiatives inspire me, and they benefit from donor partnerships, but each of those is entirely 100% designed and implemented by local actors. This gets me to a key point here. Local control must increase as circumstances and international assistance changes. When I speak about localization, I like to say that localization is aligning authority for decisions with those who are most directly accountable for results and outcomes. It makes sense to think like this. It's a paradox, really, that localization can actually speed our progress towards achieving global goals. Localization can speed our progress towards achieving global goals so long as we don't sacrifice our ability to learn and share from global experience. And it's a lot more than moving money around. It's sincerely creating opportunities for local actors to design, deliver, and deliberate on the results. And in a short time, we're going to have a plenary discussion right here with people who will share about that. I want to give you a couple of quick bullets of what we've been at work doing in CCIH to support these types of work. First off, if we're going to succeed further in our work, we want to plug gaps about how Christian health landscapes are understood so the people who design, fund, and implement programs have accurate information about what all of us in this room can do. And when I say accurate information, here's an example of a problem. There's a data set compiled from ministries of health in Africa. It's compiled by the World Health Organization. And they track ownership in Uganda, Cameroon, and Liberia. Hands? Anybody here from Uganda, Cameroon, Liberia? According to this data set, you have no faith-based health facilities in your countries. Sorry to break that news to you. However, your counterparts in Kenya, Sierra Leone, and Ghana have got a lot. Obviously, there's a problem with the data, and so we're working on that. Last year, we formed the Christian Health Asset Mapping Consortium. The Christian Health Asset Mapping Consortium was founded by the Africa Christian Health Association's platform, ADCHAP, you're here. The Catholic Health Association of the US, I don't know if Bruce is here yet, but he's coming. The Dalton Foundation, great. The International Christian Medical and Dental Association, and the World Council of Churches. Where's Mwai? All right, you're the founders. This consortium will increase resources, learning, and partnerships in Christian health services by improving understanding of the nature, scope, and location of those services. We're creating a platform to share information about data, not create a major data warehouse. We'll make it easier for you to find who's got the data. We'll analyze data to inform stakeholders, and we'll provide you with updated technical information. Just last week, we released version 2 of a data brief that summarizes Christian health assets in sub-Saharan Africa, showing that there are 8,355 Christian health assets in 17 countries. And you can see the numbers there. Yeah, real numbers. And if you're quick on your phone, you can grab the QR code, but if you're not as quick as I'm kind of slow, you can also go straight to the back after the meeting, and there's a copy of the data brief actually printed out back there. And you can actually see the breakdown by the country, and don't worry, Uganda, Cameroon, and Liberia, you're in there. I use this sort of data at least 3 out of 5 days a week to explain something about our landscape, who's providing what and where. And one audience we like to share this with are those who are responsible for shaping US government policies and programs. And this gets me to a final point that I would like to share, which is our role in advocacy in a time of great change. Dick, you rightly said, one of the reasons to be coming back here, difficult as it is, visas, oh my gosh, plane fares, travel, complexity, but it's important to be in DC because people pay attention. We want to send a signal that our global members care about what happens in this town. How many of you here are PEPFAR recipients? PEPFAR. How many of you would like to be PEPFAR recipients? All right. PEPFAR is one of the most successful US government investments in international health ever, credited with saving millions of lives. And PEPFAR is right now up for reauthorization. It's a process that only happens once every few years. There are critics right now who have leveled accusations against it who misunderstand what PEPFAR is doing. But we're working very hard on that to counter some of that information. Our advocacy, when we go to work on advocacy, we participate in over a dozen advocacy groups. We have frequent meetings with staff of the US Congress and federal agencies. Last week, we provided written testimony to the Senate State and Foreign Operations Committee. And this Thursday, several of us will meet on Capitol Hill to discuss important matters affecting our community, including localization and then PEPFAR. We advocate where we can make a difference and where we have sufficient evidence behind us, and we don't engage in ideological advocacy. There are a lot of groups out there that have that feel something, and so they advocate on that. But we ground our advocacy in cases where we have data. That data, sometimes we can generate data ourselves from our own work, but we count on what you are doing in this room. When we come looking for information or insights from you, it's because it's helping to fuel what we do. In our advocacy, we've had numerous productive conversations with so many different offices. One of those is Senator Marco Rubio, senator from Florida, who sits on both the Foreign Relations Committee and the Appropriations Committee. Senator Rubio supports the New Partners Initiative, which you'll hear about briefly. We're going to hear a greeting now from Senator Rubio. Please look past a small mistake he makes, that this is our first CCIH conference. I think he meant first in person since COVID. So please listen to what he has to say.
Hello, I'm Senator Marco Rubio, and I want to welcome you to the first conference of Christian Connections for International Health. I also want to thank you for all that you do, both as local organizations and as advocates of global health. It's important because it shows America's goodwill at a time when our international reputation, it matters more than ever. But it's also important because, as our faith teaches, everyone deserves to be treated with dignity and with care. I co-sponsored the New Partnerships Initiative Authorization Act last Congress to ensure your life-giving work can continue. As we stand together, remember that in the Lord, your labor is not in vain.
I think we just turned the recording on. I guess that was me. That's fine. No, that's cool. That means that I have to start over again. So welcome, everybody, to the 2023 conference. I'm so glad you're, I won't do that. No, we're grateful for those kind of relationships with the staff of Senator Rubio. And he is co-sponsoring that New Partnerships Initiative legislation. Here's another example of strong relationships, in this case with USAID. We've enjoyed productive conversations with the Global Health Bureau for many years. And today, the person who heads Global Health at USAID is Dr. Atul Gawande. Dr. Gawande is a bit of a star in our health world. In fact, I can remember reading his book, Checklist Manifesto, some years ago, and it really inspired me. Dr. Gawande's got a video greeting for us.
Hi, thank you for inviting me to participate in your conference. I heard this the first time you are gathering to meet in person since the pandemic, and I wish I could be there with you today as well. But I'm grateful for this opportunity to say thank you for the work you do and for your tireless efforts to advance our shared global health goals. CCIH and more broadly, faith-based organizations play such a critical role in supporting the work of USAID in communities all over the world. That is because faith leaders, congregations, and organizations like CCIH are spread around the world. And you have deep ties in these communities rooted in trust and compassion. You have the ability to support populations affected by the diseases we fight every day: HIV/AIDS, tuberculosis, malaria, and so much more. You, who have these relationships, can turn the tide on stigmatization or provide group support for those in need or seeking counsel. Faith groups, I have seen, are such skilled partners in program implementation because of your close connections and deep understanding of the needs of the people you work with and you serve. We rely on your networks, on your insight, and your social influence as critical partners in our fight to improve global public health outcomes. But I know you know all this well. It's why you do the work you do. I want to now talk for a moment about our commitment at USAID to investing in our local partners, what we call localization, and why partnering with faith-based organizations like CCIH is foundational to the success of our localization work. As Samantha Power, our administrator at USAID, said, if we truly want to make aid inclusive, local voices need to be at the center of everything we do. And she has instilled this principle in every team and every leader at the agency. USAID's localization effort has 4 pillars. First, we want to shift power to local actors and give them a meaningful seat at the table and make sure their voices are heard. By 2030, our target is that at least 50% of our activities will be led by local actors throughout priority setting, project design, implementation, and measuring results. Second, we are channeling a larger portion of our assistance directly to local partners while ensuring accountability for the appropriate use of funds and for achievement of development and humanitarian results. We have a specific target there, and that is to provide at least a quarter of all our funds directly to local partners, particularly smaller civil society and other community-based organizations, by the end of 2025. Third, we're adapting our policies and program practices to foster locally sustained change that is tied to each country's unique context. We've released updated policies that change our approach to local capacity strengthening, how we evaluate risk, and how the agency does acquisition and assistance. I know those don't sound like the most exciting topics, but these are key to shifting how a large agency functions and engages with local actors. Finally, number 4, USAID will continue to serve as a global public advocate and thought leader, using our convening authority, partnerships, our voice, and the power of example to catalyze a broader shift to locally led development. These are key steps we are taking to ensure that we can be more effective in partnering with frontline organizations and communities. To be successful in our localization and broader development objectives, USAID has to continue to engage actively with civil society. And for that reason, we're so grateful to CCIH for playing such an important role in programs like USAID's Momentum Country and Global Leadership Award, leading the faith engagement team, mobilizing religious leaders and faith-based networks, and expanding utilization of high-impact reproductive, maternal, newborn, and child health practices. Through Momentum, CCIH collaborates with many leaders of faith communities to understand concerns about vaccines and to identify promising practices to overcome concerns. And that resulted in a toolkit to support dialogue and sharing with faith-based organizations and religious leaders to address vaccine hesitancy and improve vaccine demand. In India, Momentum is mobilizing faith-based leaders to protect the rights of girls in their communities, to empower youth champions to promote girls going back to school and dissuade them from early and forced marriage, and activate health communications platforms to message the importance of keeping girls in schools. It's also linking those exposed to or at extreme risk of violence to available protective services and psychosocial support. As we look ahead to new and emerging global health challenges in the wake of COVID-19, we are that much looking towards you all, our trusted local community partners, to effect change. As many know, we announced a new concerted effort to support countries in reorienting their health systems toward primary health care, the key health services that meet the needs for enabling lifespan from childhood to full adulthood. This program, backing primary care, is called Primary Impact. And we already have work underway in 7 focus countries: Ghana, Cote d'Ivoire, Nigeria, Malawi, Kenya, and in Asia, Indonesia, and the Philippines. The success of Primary Impact relies on the support, participation, and commitment of partners on the ground, and that includes you, our faith-based partners. Our global health goals and our local partnership goals are intrinsically woven. So thank you for the work you do each day. Thank you for your ongoing championing of so many of our USAID programs. And thank you for working together with us. I wish you a very successful meeting.
it's really exciting when you sense with somebody like that they actually really get it. They really get the issues on the ground and the struggles that the people face, and we appreciate the interactions that we have. Speaking of appreciating the interactions that we have, I'm glad that he mentioned something about momentum. I now have the pleasure to introduce to you Dr. Koki Agarwal, who is Vice President for DC Operations for JPIGO and directs the USAID Momentum Country and Global Leadership Program, for which we lead the Faith Engagement team. This program has co-sponsored this conference, and I'll say something more about all of that after we hear from Koki, but please, Koki, thank you.
Thank you so much, Doug, for that introduction. It's so wonderful to be here in person, to be here with this group to kick off your annual conference. And Doug's words about waiting 3 years to be here in this beautiful venue really made me feel like how much we appreciate the being together, being face to face, being able to interact with each other, have conversations, laughter, and the importance of the discussions that will happen over the next few days. I want to take a moment during these welcome remarks to talk about something else that the pandemic has taught us, that partnerships, us working together in new and different ways, are absolutely critical for improving health around the globe. I've been working in this field for more than 20 years, and I have seen the progress we've made, and I'm so glad that Doug referred to it. It's incredible. For example, in the last 30 years, we have reduced the maternal mortality rates by more than 40%. And similarly, the same reductions for newborn and child mortality. But in many countries now, we are seeing that there is a risk of missing the goals that have been set at the global level, the Sustainable Development Goals, to reduce maternal, newborn, and child mortality. And the latest numbers show that some of the countries are actually facing a stagnation or even an increase in maternal mortality at this point. So while we can celebrate what we have accomplished over the last few years, there is no time for us to rest. It is clear that we cannot accelerate our progress, especially with these challenges that COVID-19 brought to us, by continuing with our usual way of working, our usual approaches and usual partnerships. There is no one-size-fits-all approach to improving health and big challenges. At this time, we require a different way of working, a different way of bringing together people and stakeholders to work on a common goal. This way of working needs to be built on new kinds of partnerships, ones that are inclusive, flexible, responsive, and most of all, locally led. Dr. Gawande did a very wonderful job illustrating all of this in his talk right now, how indispensable faith organizations are in the countries where we work, with their strong ties to the communities and to creating and leading the change that is required for locally led partnerships of the future. USAID's Momentum Country and Global Leadership project has worked with more than 100 local partners in the last 4 years, including many of them being from faith organizations connected to us through CCIH, and thank you for the team for making those connections. Dr. Gawande provided some great examples of this work, and I'd like to share a bit more about what we've learned in general, giving you a few of my thoughts on the principles that will drive these partnerships in the future. The first principle I wanted to highlight is the principle being open, the principle of openness. Openness to a new way of working, to create and foster the partnerships and partners that might not be usual partners that we work with, how to bring them together. The second is time. Business as usual can be fast and quick, but it takes time to create and foster new partnerships, new stakeholders, and deploy capacity building approaches that will lower barriers to entry into these partnerships. And the last one is a shift. Progress requires a true shift in the leadership and priority setting away from places like Washington, D.C. to countries and communities. And you'll hear more about this every day that you're here. Building strong and inclusive partnerships for global health programs is not future work. It's urgent work. It's work that we need to do currently now. And if we have to commit to the change that we want to bring about in how we work with partners. I really want to thank CCIH for the partnership and your leadership in this urgent work. We cannot wait to be offered a seat at the table. We have to grab a seat at the table to make a difference. And thanks to all of you for being here and for you to create and foster partnerships that benefit mothers, newborn, and children in all the countries where we work. Enjoy your week, and I really look forward to learning from you. Thank you.
Koki, when you were speaking about that, and you were saying something about embrace it, show up and take your seat at the table, and this kind of thinking. I just really want to share my respect for you and the work that you've done personally. One of the things when we started this program, we had our kickoff meeting. I can't remember now when that was. Was that January of 2019? And you walked up to me at that first meeting. That was our first time to meet in person. And you looked at me and you said, "Doug, I'm so glad that CCIH is part of this. I'm so glad that we have a faith engagement team. Now you need to bring your game," basically, is what you said. Oh. That's high praise. We took the challenge seriously because I think you said there's a lot of partners. It's a complex program. There's a lot of partners. We need to become known. We need to become recognized with them. And I think we took that back. I know Mona and Kathy and I and the others on the CCIH team have tried to live into that. And I'm glad that there was a couple of recognitions also from even Dr. Gawande. Speaking about that, we've tried with things like helping improve wash and health facilities in faith-based facilities in Ghana, Uganda, and Sierra Leone. We've partnered with Chazal, Florence is here, to advance maternal and child health in Sierra Leone. We've done the work on vaccine confidence that Dr. Gawande mentioned. That toolkit is being tested right now. We worked in Bangladesh with LAM and World Renew. I think you're here. Okay. We collaborated with others on assessments to improve faith-based drug supply organizations. We drafted high-impact practices for family planning. Still working on finishing off that, I think. We've recently drafted a template to code and track USAID investments in faith-based health work. Why? Because in a program complex as Momentum Country and Global Leadership is, we actually need a way to understand what everybody's doing. And so we sat down and created a template, a typology to describe what faith-based investments are in health, and what USAID, to help us track what USAID is actually doing. And I think that's something, that tool, that typology is something that we can use beyond Momentum Country and Global Leadership. I think the information from that can be taken for advocacy, but also it can help inform other programs. And so we'll be sharing more about that. I am really excited about the directions that we are going with all of this. And Koki, I'll just say one last thing. Momentum Country and Global Leadership led a pre-conference this morning on monitoring and evaluation and learning. And that there's a reason that we picked that subject matter, because the thinking from that group has been, from your evaluation team at Japago and as part of Momentum, has really been inspiring for us. And so there's a lot of good insights from that I think we can help to popularize. So we're grateful for that. So thank you so much. And thank you for being here with us. Okay, now I get to actually sit down and be quiet. Are you happy about that? No? That was a trick question, by the way. We're going to turn now to our final event, the anticipated discussion about localization. And when we thought of having a prominent discussion, we wanted it to not be another rah-rah event about localization, okay? This is the time when we can actually get real about how is it working, what's going well, what could we do better? And I could not imagine three better voices for exactly that. Our moderator, Kate Onyejekwe, is the director of the International Division for JSI, where she oversees JSI's portfolio of global programs and their technical competency centers. Adam Phillips is the executive director of USAID's Local Faith and Transformative Partnerships Hub, overseeing locally led development initiatives, the New Partnerships Initiative, faith-based partnerships, diaspora engagement, and the American Schools and Hospitals Abroad program. When do you sleep, Adam? And then Karen Sichinga is the executive director of the Church's Health Association of Zambia, CHAZ, and I think many of us in this room have known her for a long time. In fact, she, I think, received the International Health Champions Award at the last time that we met here. So I would invite all three of them to kindly come forward. So Kate, Adam, and Karen. And I'm going to turn it over once you're third person. You're welcome. And officially now, I turn it over. Kate, take us away. Thanks.
Thank you so much, Doug, and thank you, Koki, and all the previous speakers. It's such a privilege to be here. Welcome, everybody. I can't start without saying that one of the first conferences I attended in the United States was a CCIH conference in Maryland, and I have not forgotten it. It was such a time of renewal for me, and I'm so privileged to be here this evening among you all. As the flyer had said, localization is really the defining feature of our times. It is the culmination of years and years of advocacy and attention to the complex relationship within the development ecosystem between funders and grantees, and between different levels of grantees, the international grantees, the international actors, and the local actors. At the core of it, as Dr. Gawande has said, is the attempt to enable our local actors to exercise leadership over their health programming in their contexts and in their communities. And again, as Dr. Gawande said, it's often accompanied by, among other things, the pledge to shift funding to local organizations. So nobody is questioning the need for localization at this time. We are all in agreement. But there are also some definitional issues we need to deal with. For example, what does shifting power really mean? Is it actually a stack, a binary, as it suggests, like between the global south and the global north, between the local and the international organizations? Will local organizations completely replace international organizations in this field? If so, what is it going to look like in a few years when that happens? And if not, what are the kinds of partnerships, as Dr. Koki Agarwal has said, we need to move this forward? When Doug asked me to moderate this plenary, I just reflected. I was like, and I told him that. I said, you know, I've been involved in so many conversations around localization, but I've never had one that focused on the faith community. I just thought about that. And yet, as everyone acknowledges, faith actors are acknowledged to be deeply entrenched in their communities with deep knowledge, trust, influence, authority, commitment, and intrinsic motivation to health and well-being. So, and in humanitarian and fragile settings, they can be often the first and last resort in our communities. And what does that say in other words? Faith actors are not just foundational, they are as local as they come, right? But there are different kinds of faith actors as well. Olivia Wilkinson, in a recent publication, identified 5 from international organizations and networks like CCIH to the ones that our friend is coming from, the Churches Association of Zambia, to little places of worship in our churches, and we commit to do things. And so the question is, what role can each of these actors play? How can faith actors become engaged and better engaged with localization efforts? How can donors better engage with them? What do we need to do to work with donors to better engage? What examples of successes? Doug was talking about our assets. What are those assets we have that we need to shout out to the world so they know that we are there? And what are the kinds of recommendations that we can have? These are the questions that I thought about. I'm sure you're thinking about them as well. And who better to help us address some of these questions right now? So I would let them please introduce themselves and give us some opening remarks. And I'm sure actually, that we're going to have a very engaging conversation this evening. Thank you.
Okay, I'll go first.
I am moderating.
She's going.
Ask you
Okay.
to start.
It is on. Good afternoon or good evening. I'm happy to be here, and I just want to say thank you to the organizers, CCIH management, for inviting us to just come and share what to us localization means. I wanted him to start first because he's a donor. No? Okay. Yeah, I think that for us it means, I think we've heard the objectives already, the objective of localization, and they mean well. I think the question here is for all of us, and I think I'm also trusting my colleagues have the similar experiences from where they're coming from the global south. I think what we should be asking here is, has it worked? Is it working? To what extent is this working? And if it's not working as expected, what can we do? So I think if I want to share our thoughts from the Churches Health Association of Zambia, I want to respond to the question, is it working? To what extent is it working, and what can we do about it? For us, I think we think that it would be working when more indigenous local organizations prime for proposals. Right now, what we see at country level is we see more of the international NGOs priming for the proposals. And there are 2 reasons to that. First of all, it is felt that local indigenous organizations have no capacity to handle large-scale funding. The second thing is that local organizations do not have the capacity in terms of human resource. I think that is what it is felt. And most of them, the group that usually perpetuate this notion is those that are working in donor organization at country level, They always feel that we do not have the capacity as local organizations. And also, when we try and build the staff and make sure that we strengthen the human resource capacity to handle large-scale funding or even programs, usually these members of staff are poached. After you've trained them, after you have mentored them, after now we think that now we are ready to implement these large-scale programs and projects, and large-scale donor funding, they are poached at country level. They end up at USAID, they end up in PEPFAR programs, they also end up in UN, and I mean, we don't feel that bad because we've trained, but at the end of the day, there's a chronic situation in our organization that we don't have the capacity to implement. We see that this can work when local communities can lead the interventions. We also think that it can work when these local capacities are strengthened and sustained. We also think that it can work when increasingly proportion of resources would go to local organizations such as ourselves, and also local organizations effectively developing and delivering developmental interventions. That's when we think it can work.
Thank you. Yeah. Thank you. Well, good evening, everyone. It's quite an honor to be here among so many friends. I see some friends here in the crowd, and it's good to be back in person. This is my first time, but at CCIH, but I'm seeing this a lot. A lot of groups are having their first time back, so there's something really delightful about that. Doug, thanks for your leadership, for hosting us, and for saying my long title. You should see it in Arabic. I was in Baghdad, and they had it all on one piece of paper, and it looked ridiculous. It was lovely. It was very lovely put, but it was just like, yes, so I basically wear two hats. I lead the Local Faith and Transformative Partnerships Hub, which houses our faith-based work. I'll talk about that in a second. But the LIFT Hub is really designed to be the first stop shop for new and non-traditional partners. Now, that's a bit of a misnomer when you think about the faith community, because there's nothing new or non-traditional about working with the faith community at USAID. We've been doing that for 6 decades, and particularly for the last 20 plus years in this sort of interagency, US government-wide approach across administrations on faith-based and neighborhood partnerships. So I do lead that effort too, which serves as a senior advisor to the administrator and kind of thinks about all of our strategy in collaboration with the White House and our interagency partners in the Center for Faith-Based and Neighborhood Partnerships. It's really part of a wider working network to advance President Biden's mandate to serve our neighbors in need, both near and far. So when I think about the compounding crises and humanitarian disasters affecting communities around the world, I'm struck by the conference's themes of hope and perseverance. I think that's really critical, and we all need it. I come out of the faith community myself. I'm a pastor. I'm also an advocate, so wanting to definitely talk about shifting power. Where we see hardships and catastrophes from crises around the world, we also see remarkable courage and fortitude. In areas affected by natural disasters, small businesses and communities continue to rebuild and begin anew in the face of drought and food shortages. Mothers sacrifice to feed their children, and in response to Russia's illegal and unprovoked invasion of Ukraine, the Ukrainian people have remained remarkably strong and united in defense of their country. Yet while these acts of courage are inspiring, they also demonstrate the need for greater humanitarian assistance and long-term support so that communities can withstand these crises and shocks when they inevitably do occur. This gathering, aptly organized around these themes of humility and perseverance, presents an opportunity to gather as a broader development community, reflect on these complex challenges, and discuss the many, many, many opportunities for partnerships to support communities affected by these crises. As many of you know, one way USAID has been working to address these compounding crises is through this localization reform agenda, and it really is about taking forward this call to action, this reminder, this voice, sometimes in the wilderness, that has said nothing about us without us, right? And that's borrowed from the disability rights community, and we have heard it in the faith community. We've heard it in indigenous communities. We've heard it in LGBT communities, youth-run organizations. Nothing about us without us. So how do we make sure people are at the table that may often are left out? And that's what this is about. I think we've made great strides in directing funding to local organizations. We can share a little bit more about that later. But I look forward to the conversation and the hard questions. Yeah.
Thank you.
Yeah.
Thank you so much, Adam. Madam Karen, I think you already started actually by responding to some of the questions that we thought about. One of it is the fact that, of course, we all support localization, but let's imagine we're back here in 10 years, right? Or 5 years. What would we expect to be different, like really different, concretely different? Adam, would you start?
Sure, I can start. Yeah, I mean, just in the past 2 years, or really 18 months since Administrator Samantha Power announced this commitment, this top priority for her and for us at USAID to take on locally led development, to do what we are calling localization. It's been amazing to see the growing support in the development sector. We see it from faith-based actors, faith-based organizations. We see it from all the groups I was talking about earlier, women's-run organizations, youth, et cetera. We see it even in the INGO community, the international NGO communities. Groups like CRS and World Vision are advocating for these changes as well, and we also see it in the for-profit community. So something has changed, and so I'm hoping that once and for all that we are not in 5 to 10 years making the case, but that the case has been made. It's not simply the right thing to do, but it's the really smart thing to do when it comes to tackling these compounding crises. Gawande laid it out really well, I thought, in the video, and we'll be sharing that out in our newsletter later this month if you want to share that with others. Some have pointed out that yes, these goals are not new, and to a degree that's true. We've been working on these for a decade. During that time, USAID developed partnerships with local organizations and provided project-based assistance to governments. We've stood up LIFT Partnerships Hubs initiatives such as Local Works, the New Partnership Initiative, the Cooperative Development Program. These all elevate local leaders and local organizations. But there are three differentiators that make the current agency-wide localization efforts very different from those in the past. One is the framing. In the past, USAID has emphasized local awards as the main way to advance localization. But while control of resources is an important aspect of shifting power, it's only part of the story. To shift power, we need a more comprehensive set of approaches. It's not just who we fund, but how we work. I'd say the second differentiator is the sources of support. There's new consensus that we need to change the business of aid and reckon with historical inequalities. This, I think, has gained momentum in no small part because of the growing global movement around diversity, equity, inclusion, and accessibility, which faith communities around the world are in many ways leading. And then the third differentiator would be the knowledge base. We've accumulated a lot of lessons learned in this past decade. We know that localization efforts are time and staff intensive. We know that local actors continue to face a number of barriers to working with USAID. And that's what we get up every day to try to tackle at the agency in the LIFT Hub and across the agency. These are ambitious efforts. We have these two goals. One, in 5 years, increase funding to local actors to 25% of our program dollars. When we came in, it was in the 6% range. The agency has not been counting this number for that long, actually. But we're really proud to share that in an upcoming progress report that's soon to be published, that we've now gotten that up into the 10.2% range. And it's the highest it's been in over a decade. We know that's not all the way to 25%, and we know that time is ticking, but that goal is still of purpose for us. The second goal, I think, gets to that shifting power, and that's how do we make sure that local actors, indigenous owned and operated organizations, your local women's religious, the sisters, the priests, the imams, how do they sit at the table and help us co-design, co-create our programming? And so we are endeavoring in 10 years, so by 2030, to ensure that 50% of our programs are co-created. They're not just ideas shipped out from the capital cities or from Washington, but they're co-designed, co-created. So these are our that's our hope. I've probably spoke a little bit too long, so I'll stop there and you can react.
Yeah, I like how you talked about the fact that it's not, because that's what people usually gravitate to, is the funding goals and the timeline goals. But you're talking about how we work and about, you know, the fact that we actually want to change the way we work, that we actually want to have people co-lead and all that. And I think it takes it back to what Karen has talked about. And so Karen, maybe you want to take us, you had highlighted some of your goals, which is, yes, we are going to be priming. That's clear, right? We are going to be priming. We are going to be at the table. We are going to be training people. We have the capacity. How do you respond to sort of what Adam has talked about in terms of what you see in the way we work?
Well, I think in the way we work or in the way the partner works, I'll start with the way the partner works. I think if we have to take this forward and we have to ensure that this localization works, we have to dismantle some of the cartels that do not want to let go and genuinely transfer capacities and technologies to local organizations. So these cartels within USAID or PEPFAR or any other partner, you need to dismantle those. Our experience is that, and some of these cartels are at country level, because people fear for their jobs, so they don't want to let go. Those people that you work with. And donors themselves, USAID and others, you must really commit. We must see that commitment. And I'm not saying that there's no commitment. No, there is a commitment, and you have made a lot of progress, and that we celebrate here. But we need to see a real commitment to localization by deliberately and genuinely investing in local organization capacities. Look, you have invested a lot in international NGOs that you set up in our countries, and they're still there. And we can see that you have invested a lot. You need to do the same for local organizations. Because we're not saying we have arrived, but we have the capacity. I say this because as Churches Health Association of Zambia chairs, we have primed before, and we've been successful. But what hasn't worked when we have primed is the fact that you insist that we set up a separate unit within the organizations. And you want us to have a chief of party when we actually have the leadership in the organization. You want us to have a separate unit when we have a health programs department in the organization, when what we want is you to integrate what is already existing. So when you do that, when you insist that we must have a chief of party for your project, because then we start calling it your project, and we can't integrate, and it's not sustainable. After 5 years, you pack your bags and go. It is not sustainable because we have not integrated. And it's different to show the real impact after we set up a unit within the organization. You call this person the chief of party, and from the USAID, you are just communicating with that chief of party. And forget that there's leadership in that organization. And guess what? After 5 years, when you've packed and gone, and then you are sending the auditors 2 years later, the staff that you made us employ for your project have already gone. And we are left to be answering those questions. And it is very, very unfair. It is extremely unfair. So what we want you to do is to genuinely invest in the local organization. And when we prime, when we're saying, and we've tried at CHAS, we've argued, we put our argument on the table. Can we integrate into our system? Because we have a health programs already department. No. But I think we would want more integration. We would want you to believe in our capacity to deliver. There are other funding global mechanisms that have believed in our capacity to deliver. We want USAID to do the same. I think international NGO, I think we need them in our countries, and we can work alongside with them. And if they're international, they need to know that at one point, they need to leave because capacity have been built. Donor staff, but your staff in this USAID, PEPFAR, and other organizations, and I'm not pointing at PEPFAR and USAID alone, and then we have other EU projects. I think donor staff must be made to take localization seriously. By and large, they tend to be anti-localization because this threatens their job security. Okay. This is what we see.
Thank you, Karen. You've actually gone there, there, right? Like some of the issues that, some people have been thinking about and not raising is really the nitty-gritty of it. As I said, are the international organizations going to go? What is the language that you use and how do you integrate? And this actually takes us to some of the questions, again, that people bring to the fore when they are thinking about localization, which is, okay, international organizations, workloads, attitudes, and there are things that, on the other hand, international organizations are also saying, well, but, on the one hand, you're saying you need your capacity to be built. On the other hand, you're telling us to go away. So where are you going? Like, how do we get to this point, right? And so my question to you, Adam, is in the light of what Karen has raised, and in the light of the other argument that people raise, which is, okay, where do we go from here? What are the risks that you see in terms of localization and what the local organizations really want, and how can we mitigate that?
Right, and thank you for the feedback. And people will say the risks are many. We at USAID are rising to the challenge of those risks. We've heard it from partners like you. One of the things that I'm most proud of my time at the agency is that we advanced the local capacity strengthening policy. It was originally called the Local Capacity Development Policy, and folks like yourselves spoke into that comment period and said, we don't need to develop it, it's already there. We just need help strengthening it. And so that's the kind of good feedback that the bureaucracy needs, the agency needs, and of course, so many of us knew that. So, I think really about how to tackle these risks head on. I think the challenges are real, but they're not impossible whatsoever to overcome. So we're currently working to integrate principles of localization into the very fabric of how we do our business, into the very bureaucracy of how we do our partnerships, our work. So we're also encouraging our implementation partners, both the large INGOs and the small local organizations to do the same. And so we often talk about shifting the power. We talk about these metrics of 25 and 50%. But we talk about this bureaucratic kind of work that we have to do, getting into the DNA of our approach. But we also are talking about co-convening. So that I'm glad that we're being able to convene here with CCIH. I've been doing this quite a bit lately with faith-based and not particular faith-based groups. Some of the ways we're doing the really hard bureaucratic work, it's kind of threefold. One, we have a new risk appetite statement that encourages staff to work with new local partners, recognizing that this way of working comes with new opportunities for achieving long-lasting results. Our new LCS policy, which I just mentioned, the capacity strengthening, establishes agency-wide principles that emphasize that capacity strengthening work should build on existing capacities and respond to local priorities. It encourages USAID to focus more on the capacity strengthening goals of these programs and places more emphasis on accountability for achieving capacity strengthening goals. We're about to launch the implementation process of that policy. And then our new A&A strategy, our acquisitions and assistance strategy. It's oriented around achieving sustainable, inclusive, and locally led development. It is working to reduce the barriers local partners face to working with USAID. I also want to emphasize that we are set to launch, I'm hoping later this summer, the agency's first ever strategic religious engagement policy. It's actually the U.S. government's first policy. So yeah, thank you. That's it builds on 10 years of a mandate from President Obama to integrate, as you were saying, faith actors, religious partners' voices into our foreign policy. And so this policy will help guide our workforce in 100 countries around the world, and in all of our sectors, it'll center religious voices, religious faith-based organizations. So I'm excited about that. We've had strong support from State Department, USDA, USIP, and others. So I think this is about policy change. It's about bureaucracy change, which is so hard at times. It's the sludge of the bureaucracy, but it's also about how to come up with this tough feedback and then figure out ways to work anew together.
Thank you, Adam. So, I mean, what you've articulated is really that, there is response to feedback from USAID. The progress that you've made, even in articulating from capacity. I remember when it used to be capacity building, from capacity building to capacity strengthening, and now to sort of multi-dimensional areas is an indication that there's feedback is being received. And I think, one of the things that I think about with you, Karen, because you've been really quite open in terms of international organizations should leave when they need to. You should dismantle the aid, but we also need our capacity built. Do you see like a sequencing in this that enables it to happen, or like everything should happen at the same time?
Thank you. I think it's a process. Everything can't happen at the same time. At CHAZ, we have had situations where we wanted to prime and then felt that particularly grants of the contract nature, those are very difficult for local organization to prime because you need to advance funding. You may be needing $1 million to advance. And a local organization, a local indigenous organization cannot come up with that money. So what you find is that the international organization, because they have their partners and some of the offices in Washington or New York, they're more inclined, and they will, because they will have that capacity of having to pre-finance, particularly with grants of contract nature. So as local organization, I don't think that we would have that capacity unless we go into partnership with other organizations abroad that will help us pre-finance. I think my take-home message is that it's a process. Not everything can happen at the same time.
Thank you. Thank you. And this links to really our last question that I'd like, I'm sure all of us as connected to CCIH are thinking about is, what suggestions do you have for Christian leaders then, and how they can help localization succeed? There are many categories of Christian leaders, some like CCIH, for example. What role can a CCIH play versus what role can maybe a church play? And how can they help to move forward the localization agenda at their various points of context, as it were? I'll start.
I think for me, CCIH is, like I said to the membership of CHAZ, the mission hospitals, who's CCIH? we are all CCIH. We are CCIH. And Doug and the team, they're the frontline soldiers, and they are situated in Washington, and they're already doing. And I think the advocacy role, bringing us together and creating the space for us to share this experience, creating the space for us to interact with our partners, USAID, creating that space of open dialogue. And I think they're doing it very well. In terms of our local churches, I think there we have a problem also, the faith-based leaders. And I can see that we have some religious sisters here. I hope you are a Mother Superior. And I would like to address the Mother Superiors. Our experience in Zambia is that, and we've already communicated this concern, as soon as you build capacity, in some of the nuns that are administrators and are running the hospitals very well, lo and behold, that nun is transferred and taken somewhere else. And so I think the message to our faith leaders is that we need to recognize where capacity has been built, and it's for a reason. Otherwise, you keep transferring, and then you bring somebody else who's not trained, and then we are told, you see, your people, they have no capacity. And I think as faith leaders also, we need to make sure that, we are dealing with donor money. We have no choice but to be accountable and transparent in the manner that we spend that money.
Yeah, I'll keep this short. I think you have no better advocate for you here in this town than Doug. He's one of the first people I met when I moved back to Washington for this role, and I'll take his calls from an airport or wherever, because I know that he's offering good insight and feedback to what's happening on the ground. So by all means, always hesitate to reach out to our team directly, but know that Doug is carrying forward the call. And I think we need to hear more about this, especially at the intersection of all of these compounding crises. We know that health is a matter that is affected by hunger, and we know that these are affected by matters of conflict in the world. So we want to think through ways in which CCIH and its partners can help us strengthen all of our efforts on these areas. I think localization can take many forms. Obviously, I'd encourage more established partners to consider what shifting power and resources to local leadership can look like. We have this really interesting partnership with AmeriCares and CCIH through the Community Partnerships for Respectful Care for a 5-year activity that strengthens maternal and child health services in Tanzania through local partners. I think that's an interesting partnership that we have. But I know that we want to have some questions, so I'll just leave it there.
Yes. All right. So let's just stop there real quickly and entertain a couple questions before we close. Yes.
Thanks, Kate. My name is Simon Sentung and I come from Uganda. I work with HR. So I just want to reiterate what has been mentioned by Karen. From our observation in countries, actually, we see that there is a growing trend of a metamorphosis of the big organizations, the NGOs. Let's say organization X is headquartered in Washington, D.C., and now because of the concept of localization, they come in country and then also register as a local NGO to compete for that award. So in the end, if it's Charles, just an example, competing with X, who originally was an INGO, now because of registration, they are still the same, but now, of course, are local. So how do we make sure that we navigate that? Like you said, is it a cartel? Or how do we navigate those that really, move and flip aside and compete with the local organizations? Thank you.
Yeah, that's an Adam question, and I'll have a kind of an Adam answer. That's a very very important question you raise, and it's something that we have been pulling not our hair out, but the bureaucracy out to try to get the definition right. We have a new, as I said, this progress report that will have some more definitions around this. But yes, we're seeing this too. We are even hearing from some of the INGOs here in town that are supporting this effort. They're tipping us off to it too. So you have, I think, good faith actors in the INGO space that are trying to, I would say, police this, but you've got to have a bigger conversation around what does it mean to be truly local. And so when the administrator says local, she means deeply local, locally owned, operated, registered, et cetera, not kind of switching out the brand name and the things and all the things. But it's complicated because I was in Kenya last year, and I thought I was meeting with an INGO, and I, in fact, was meeting with a very local. They had been registered in the 70s as a local organization. They just had the branding of the INGO because that's what they were thinking forward back in the 70s on this, in that country at least. So it's not going to be a perfect kind of plan, and so we just have to have the conversation ongoing, and where we might need to adjust some things, we want to hear more feedback.
One more question, and that's it.
Thank you so much. My name Jean-Marie Vianney-Gatete. I'm coming from Rwanda. I'm representing Rwanda Interfaith Council on Health. It's a number of religious organizations working on health promotion. My question is regarding to localization. You've been talking about localization and sustainability, which is something that goes together. And you are talking about the capacity building of local NGOs. You know, in our country, we have those our local NGOs, those interfaith NGOs that working with the other organizations like UN agencies that can be the principal recipient of UN agencies. But becoming the prime of USAID, it's still a big challenge. What are you going to do as how are you going to engage those local NGOs and to become the prime and they becoming the principal recipient of USAID? Thank you.
So the question was about
how do they become prime? So some of them are already principal recipients, but they still have difficulties navigating the USAID.
Okay, I've had heard something in the question too around partnering with UN agencies, which is often very complicated, and we're trying to co-convene and encourage that as well. I mean, one easy way to learn how to become a prime would be to go to workwithusaid.org. It's not .gov yet. It's workwithusaid.org. It's a website that is a portal that helps us both learn about local organizations as well as offer ways in which local organizations can learn about where we're working or calls to co-design and co-create. We are in the process of translating that into languages other than English. I'd like to see us try to get more very local in the language translation, but that'll take a little bit more time. But I would encourage you to do that. And then I think continue to pull together as I love that you represent an umbrella organization for the country. I'm going to be in Rwanda later this year when we do a town hall or a coffee or a round table, as we say. Make sure that we have the right people in the room because we need to know and we can help introduce folks to the mission in that way as well. So those are two ways I'm thinking about it.
One more question.
Thank you so very much. I think this is a very interesting discussion. I'm Florence Bull from the Christian Health Association of Sierra Leone. I think the issue around the international as well as the localization, what's the way forward is, I think it's complementarity rather than competition, and valuing what each person is bringing to the table and see how we can actually harness such strength and weakness for the common good. So it's complementarity and respect, especially for what each partner is bringing to the table. Thank you.
Thank you, Florence. One more.
Hi, good afternoon. Davina Shah from World Relief. One question or thought that I have is thinking about the conversation, not just from the perspective of prime, local, and funding, but also thinking about how community-led resource mobilization can happen at the local level, not just community-led, but even at the countries. There's some, of course, there are different varieties of where different countries are, but let's not assume that resources only come from the outside. And so I'd love to hear your thoughts from all of you, actually, about what that looks like in terms of resource mobilization, also coming from countries and supporting, and this idea of, we're not just talking about shifting power as if power is ours to give. That's not the case. And so power does exist in these communities. And so I'd love to hear a little bit about that.
Thank you, David. Karen, do you want to think about that, respond to that? What about community resource mobilization?
I think that is happening. It usually depends on the health systems in each country, where you even have some communities, contribution to the health sector. They go to the clinic and they bring something. So that is already happening, and also working with the private sector. Like at Charles, we're already working with the private sector. We're working with Zambia breweries already. On alcohol abuse and the adolescent, we mobilize that. We also working with Stanbic Bank that has helped to build mother working shelters. So that is already happening. But I thought that this session was about USAID, ESG government, and us and localization.
I would just add that I think there's an interesting role for philanthropy to play in this. We had a significant event at UNGA, the General Assembly, last year with the administrator and a number of philanthropies, both here and philanthropies from abroad. I think I would check out the Global Fund for Community Foundations. I think they're doing good thinking on this. There is a bit of a challenge for us to aggregate local funds, but it's not insurmountable. So that is one piece to that. So yeah, I think that's how I think about it.
Thank you. Thank you so very much. This is such an important conversation. We could continue, but we have raised some really interesting points. One is we all agree that localization, we shouldn't be making the case for localization in 10 years. We've already made the case. We are moving forward towards that, and we do need to engage one another. We can't just suddenly say, okay, we switch a button and everyone goes their own ways. It's not, it's a complementarity, as Florence has talked about, but we do need to give one another the feedback, even if it's painful. I couldn't have imagined sitting in Adam's chair when receiving the feedback about USAID should do ABC. But those difficult conversations are necessary, and we need to come to those conversations with a good faith effort to actually move the agenda forward. We all have a part to play. And sometimes that part, as Davina raised for us, is actually about resource mobilization. So we are not always looking out to get funding from others. We are not looking for others to empower us. We are not looking for power that we need to shift that creates dichotomies, rather than just bringing us together around the table, especially as Christians. And so on that note, I want to use this opportunity to thank you for your participation, but especially thank our speakers, Karen and Adam, for your time with us this evening. Thank you very much.
You did it so well.